shooting that resulted in the death of a Corpus Christi father and sent his son to jail is prompting a look into mental health tonight.
Specifically, what happens the moment someone calls something like a crisis hotline. Our Josh Maxwell spoke with police and local mental health officials about what that response can look like. Josh?
Mike Leslie, records I obtained from the Corpus Christi Police Department show that mental health-related calls have risen sharply over the past decade, from 558 in 2014 to more than 2,600 just 10 years later. Mental health advocates say the trend highlights the need for more resources. New details are emerging in a Southside shooting investigation, where police say 20-year-old Marcus Xavier Benavides shot and killed his father Monday night. According to the arrest affidavit, Benavides was experiencing a mental health episode at the time of the shooting. It states he had recently spent some time in the hospital under antipsychotic medication and had been experiencing drug withdrawals. About an hour before the deadly shooting took place, his mother had contacted a crisis hotline after Benavides said he was, quote, needing help and wasn't feeling right, adding that he was nodding at the ceiling as though someone was there.
So as soon as they're making that phone call, they're talking to somebody who is a qualified mental health professional.
Ruth Younger with the Nueces Center for Mental Health and Intellectual Disabilities, or MHID, says for those who call their crisis hotline, they are met immediately with help.
That person is screening them for mental health. They are using de-escalation techniques, safety planning, making any type of referrals needed, and overall just seeing how they can help.
And over the years, Younger says she's noticed a pattern.
There has been an increase in those who are actually open to seeking services, and they're contacting us, whether that's calling the local crisis hotline, whether that's calling 988.
3 News requested 10 years of mental health call data from CCPD. The records show officers are responding to far more of those calls today than they were a decade ago.
They'll try and find any hooks or try and kind of catch on to maybe a theme of why they're feeling the way that they're feeling. If it's something that the person is an immediate danger to themselves or others, then we will take them to a hospital under an emergency detention warrant.
As mental health calls have increased, CCPD says its partnership with MHID has given officers additional tools to respond to people in crisis.
And we kind of get familiar with them and what they need. Maybe they haven't got their medication for whatever reason in X amount of time, so it could be causing them to have or be in crisis.
Younger says she wants anyone who calls the crisis hotline to know they're never a burden, whether it's their first call or their 10th. She says someone will always be there to help. As for Benavides, he was booked into the Nueces County Jail for murder. His bond is set at $1 million. We'll, of course, continue to follow this case as we learn more. Back to you.